We are going live with Dr. April, just kind of letting things get started here. I know it is late, 8 p.m. I am still in the process of getting my kiddos down, so my husband is handling that so I can be here with you. Hi guys, my name is Erica. I'm waiting for Dr. April. Oh, she just hopped on. Waiting for Dr. April Douglas to hop on. I'm gonna let her in. She is a viewing request. Go live. Super happy to be chatting. Awesome. We're gonna see if she comes out. It worked. Yay! I like the background. Awesome.
Thank you.
Awesome. Well, I was just about to kind of get started and you were like really fast on the ball, so I'm really excited. I'm just going to kind of let people join, and obviously this will be saved on my feed, so whomever could not join live, especially since we're on 8 p.m. Pacific, and if anyone on Eastern time wanted to check it out, it'll be on my feed so they can check it out later. But I am really excited to get down right to business to introduce Dr. April Douglas, who is a pelvic floor physical therapist based here in San Diego. And my name, if you don't know me and you found me through Dr. April, is Erica Friedman, and I'm also based here in San Diego, but work with clients virtually. I'm a pre and postnatal fitness coach, pregnancy and postpartum athleticism coach, postnatal fitness specialist, all of the things. I love working with women in all stages of motherhood, and it is a great marriage to work alongside pelvic floor physical therapists so that I can best support mamas in all these different stages. So I'm privileged to be able to talk to Dr. April tonight, and I thought we could kick things off. You can give a little bit of a background on you and how you came to discover physical therapy and pelvic health specifically, and where people can find you in San Diego and kind of what you offer.
So cool. I'm excited to be here. This is my first Instagram live, so I feel very nerdy and I don't know anything. So physical therapy was how I found physical therapy. Is pretty a typical story. I play sports and you get hurt, and but the biggest story is that one of my best friends, she had really severe burns. She caught on fire while selling Christmas trees. And so we would go to her rehab with her, and our entire job was to keep her cheery and make jokes the whole time. We weren't allowed to make any expressions. So that's how I was introduced to physical therapy with wound care, which I vowed to not do. But when I entered into physical therapy, I had a kind of a typical plan of like, oh, I'm going to do sports, and I'd love to work for a sports team, and the very typical story you hear and still hear at school. But then I learned about pelvic floor PT from a guest lecturer and was fascinated. So I did shadowing at clinics out in town while I was in school, went to a bunch of conferences. I loved it. But they tell you to focus on one thing when you graduate. And so I stuck with orthopedics. And so it was, I think, a great thing that I started that way. It gave me an awesome foundation. So I did orthopedics for a couple of years, and then transitioned to a really large clinic that does all pelvic floor PT. I was kind of the ortho gal. So I got this slow exposure where I would treat a lot of pregnant patients, the ortho aspect, and slowly worked my way into pelvic floor and had wonderful mentorship and help. And kind of the rest goes from there. I just keep getting more certifications. So now I treat all genders and hopefully pediatrics soon. And so it's been quite a journey. It's been really fun. So I've been doing this for 12 years now. So it's been really, really great, really rewarding.
That's amazing. And one thing I wanted to emphasize based on what you just said is that a pelvic floor physical therapist or physiotherapist, especially how they're called in Canada, serve more than just pregnant and postpartum women. So, or, however you identify, they serve men or they help men. I've heard, cases with young children. And so there's a huge spectrum of people that you can help. And I think a lot of people don't even realize that.
Yeah, it's, you know, incontinence or leaking doesn't affect just moms. I'm treating anyone and everyone who walks through the door. Also, pelvic pain impacts all genders. So there's just all the diagnoses do not just apply to moms. I think postpartum just opens a little bit, it opens a door to talk about it a little bit more, which I think is great. It's such a secretive area. So I'm so excited when people want to talk about it and force other people to talk about it at the dinner table. It's really, really important.
Yeah, it's very interesting. I'll take one point, and that kind of leads me to my next question. I was taking a course through Julie Wiebe, who's a physical therapist that is very well known in the space, also ortho background, and she talked about, you know, incontinence or pelvic health issues popping up in, you know, teenagers and young girls, specifically in sport, let's say gymnastics, you know, with that constant bracing of the abdominals and just a lot of the different impact movements and positions that they find themselves in. And so, you know, seeing like a 9-10-year-old girl who obviously has not had children yet and is probably pre-puberty, having incontinence issues or even diastasis recti,
Yes.
like, whoa, you know, it kind of brings a different conversation up. Okay, maybe this is something that doesn't just need to be talked about with, you know, postpartum women. So that kind of leads me to my next question is, how do people find you? Obviously, I recognize the value of pelvic floor physical therapy. I dropped my pen. But, you know, how do most people find you? Referral? Just because I know that, to be honest, with traditional providers, at least mine, it's not really talked about too much.
Yes. So a lot of us, unfortunately, how we are found is usually mostly through word of mouth, which is still great that people are talking about it. But you should be able to talk to your physicians about it, any type of physician, especially OBGYN and urogynecologists. They should be having us as part of the team. You know, the physicians, they can handle surgeries. Do not enlist me for that. They do the surgeries and the medications. And then also on your team, you should also have a personal trainer like Erica. And we're kind of the in-between. So physical therapists, we bridge that. So we are educated more in the exercise for injured patients. And also we are educated in how to accelerate your healing and create the best environment for healing. And we're also, like, every patient I view as kind of my own little puzzle. So we're trying to figure out, why are you having that pain? What was the trigger that caused it? What is the muscle group we need to work on here? And we're not going to handle the surgical or the medications for you. Now we are looking for red flags. So if something comes up, we should be the first person to say, hey, you need to go to the ER, or you need to go to surgery. And then also with personal trainers, we're that bridge as well. So hopefully we're keeping you in the gym. We're keeping you with your trainer at the same time. We're not taking you away. And also hopefully communicating all together. So then that way you can say, hey, this patient can be, or client can be pushed a little bit further, or we need to hold back a little bit until they learn this step, and then let's go. So to find us, you should, there should be kind of a team that supports you. And then also, you know, there's good old fashioned internet, which is always the Wild West. And then there's a lot of directories that you can find us on. So our national organization for physical therapy, the APTA, there's also Pelvic Guru, which is a wonderful, has lots of blogs and lots of great information and a directory there. And then also Pelvic Rehab, which is a huge company that educates a lot of us with their conferences. So lots of different websites and directories, and then you can see all the certifications and our backgrounds, which is really, really helpful.
Yeah, usually when I'm working with someone who's in an area that I'm not as familiar with, I typically use one of the directories. And then once I identify them, I then go to their website, look at their certifications, try and get familiar with the doctor. And then I kind of send it out to whomever I'm working with. I don't require that anyone I work with see a pelvic floor physical therapist, but it is certainly very helpful
Yeah.
because I collaborate with someone like you to understand, okay, this is, what is going on in, mama's body right now and how we can build a progressive program to complement physical therapy. I actually got asked this the other day. It's like, oh, are you a healthcare provider? I said, no, I'm not a healthcare provider. I'm a personal trainer. I do have several certifications, but none of them include doctor.
Yeah.
And so, I can make educated guesses on things, but I don't prescribe and I don't diagnose. So I'll say, okay, this might be this, but I recommend you go to a pelvic floor physical therapist to just double check. Because I'm not an expert on pelvic health. I'm learning as much as I can, but I'm certainly not an expert. But that leads me to maybe there's someone who, this might be the first time they've heard of pelvic floor physical therapy, or they're kind of interested in what they should be doing. So if they were to come to their first appointment, like what can they expect in that first consult with you?
Yeah, so this is always the scary thing. I think for a lot of people, they think the appointment is going to be something crazy, but it's when you first come in for pelvic floor PT, what we care about most is your story. What's going on? What causes all of these issues? How long has it been going on? We really like an in-depth history. I really want to hear what's going on because that gives us lots of clues to how we can help you and also what your goals are. There's some people that their goals may be different from mine, so I need to make sure that we are headed in that direction. The rest, the middle part of the evaluation, it almost feels like you're there for maybe your spine or your hips. So we're checking out how you walk, how you load your pelvis, what's your strength like, what's the range of motion like. We look at your spine, your hips. We also screen, especially if you're postpartum or if you have some concerns there, we also screen for diastasis recti, so looking for separation of the abs and testing that out. The last part of the exam is then checking your pelvic floor. So if you're there for your pelvic floor, there are 3 layers of your pelvic floor. And I have a little picture here. So this is from Pelvic Guru, that website I was talking about.
Mm-hmm. Yeah, she has great resources.
This is what your pelvic floor looks like if someone was laying on their back, looking straight on without the skin. So it's a series of fascia and muscle. It's nothing crazy. It's just muscle. And the 3 layers are about yay deep. So really not that deep. So also we don't use stirrups. We don't use speculums. The speculums would get in the way of actually testing those muscles. So if someone says they're testing your pelvic floor and you have a speculum in, I would question that a little bit. And it's just one digit exam. And what we're feeling for is the same thing as if I'm inspecting a knee or ACL post-op patient. I'm looking for, is it high tone? Is it gripping? Is it low tone? What's the strength like of the tissue? Is there scarring there from perhaps an episiotomy or tearing or from something else, trauma of some kind? Mm-hmm. And then the final part of that exam is then you're seeing how well that they can perform with coordination and with strength of those muscles. So a lot of times people call those Kegels, but we call them pelvic floor contractions. And while we're there, we're usually screening for prolapse. And then also looking at the skin. So usually the skin is missed, especially for postpartum with a decrease in estrogen. So if there's anything that we think is a little bit different or unique, then we would refer out, but we are checking for all of those things for you and kind of getting the big picture and then discussing as soon as the exam is done. So internal portion of treatment is not every session. It shouldn't be. It's really just gathering that information so we know what is your pelvic floor doing or not doing. And then perhaps depending on the case, we might check in the pelvic floor, depending on time frame about what's going on there.
And just because you mentioned it, I wanted to bring up that because I know that I've had people, clients and moms ask this. If you are uncomfortable with an internal, it's not required. A physical therapist, pelvic floor physical, can get a lot of information about what's going on within your body without an internal assessment. That being said, you'll get just that much more information with an internal. I know that Dr. April's coming from the PT perspective, so I'll say from a patient perspective, I've always felt very comfortable in a PT's office when having internal exams. It's nothing like an exam at my OBGYN.
Different.
And it's a very different experience. And I also love that typically the pelvic floor physical therapist will talk you through what they're doing. So I've always had the experience of, okay, this is your first layer. This is the second layer. Okay, or second layer. Okay, we're at your obturator. You know, like I've always been walked through. So not only am I understanding what's going on, but I have a better understanding of my body. So now I'm 4 months postpartum with my second. And speaking honestly, I've seen like 5 or 6 different pelvic floor PTs, because you just find someone you gel with and kind of understands your goal, your body. And I always learn something new in every session, regardless of who I'm seeing. So I did just want to hop on and say the internal is an optional thing, just in case you're a little hesitant on that, and it doesn't have to be your first appointment. I do something different in every single appointment. Or every single session, and that's really how it should be, unless there's, you know, some manual work that needs to take place that might take a little bit of time. So I just wanted to have it.
Perfect. Yeah. So there's some patients too, if they're in a lot of pain, that it's really not worth continuing the exam if you're in a lot of pain. Similar to any other part in your body, we don't, no pain, no gain it. And then also if people aren't comfortable, then people are not comfortable. So usually I start my exam with saying like, this should be pain-free and also comfortable. So if at any point you're uncomfortable, we stop. We do not need to go on. So you can do an entire treatment without internal. It's just internal gives you the most information. So it's most helpful, but you can absolutely do without it. So yeah, and there's some people out there that treat without doing anything internal at all. But I would say if they advertise that they are pelvic floor physical therapists, and they should be at the very least trained in all of that. So that would be something that you want to make sure that they have if you're seeing someone. But yeah, it's all within your comfort zone, and there's no point in pushing through something that's too painful or not comfortable. And exactly like Erica said, the treatment should be different each time. So I was a pelvic floor patient at one point too, but because I had a background, or I have a background in it, my every single treatment was internal, but by choice, because I was like, I got the rest, help me out. You know, I can't do that part. But it shouldn't necessarily be like that for the average patient. It should be something different every time, and we're usually zooming out and looking at your body as a whole versus just the pelvic floor, just one little space in your body. We just want to gather information there to see why you're leaking, or why it feels like there's pressure, or why there's constipation, or you want to have the best birth outcomes. You want to make sure that that space opens up for that baby to come through. Lots of different reasons to come in. So, and some are emergent, and some are just in cases, and some are, I just had a baby, I want to make sure everything's cool, check me out, clear me for more exercise, or clear me for running, and let's do this. So I love it when people are coming in just to make sure that they're on the right track and doing an awesome job. It's really, really great. Then I pass.
That's great. Yeah, and I will say to what you said, I did go to pelvic floor PT during more so during my second pregnancy. I went a couple times in my first, but more so in my second pregnancy regularly, because I wanted to prepare my pelvic floor for delivery. Whether or not I had a C-birth or vaginal, I wanted to make sure everything was looking good down there. And I also practiced pushing. Like I practiced different breast strategies. I practiced pushing, which when it actually, I was going to say when push came to shove, when push came to shove and I was actually in the delivery room, I was being coached to breathe very differently than I had learned in PT, which was very frustrating for me. But in the moment, you know, you kind of have to like listen to who's telling you, and you're like kind of out of it. So that was like a frustrating point for me. But I did want to also mention that pelvic floor PT has helped me uncover a couple of other things that have been going on in my body my entire life. So for me, I've had injuries on the left side of my body my whole life. Calf strain, QL strain, stress fractures, all these injuries just on the left side. And so it's just now, you know, 30 plus years of time, although I haven't been getting injured that long, but you get the idea that it's like, oh, well, there must be a pattern there. There must be something going on. So yes, Dr. April is a pelvic floor physical therapist, and the pelvic floor is her, you know, is the foundation. I mean, it basically is it's the foundation of our house. And, but it often presents itself, or things often present itself different. Like, oh, I've had this navigating shoulder pain, or I have this hip pain that won't go away, or you know, this knee pain. And sometimes that house, the pelvic floor, is really where we discover where things might be a little off. Or so that's another reason why that kind of leads me to my next question of, you know, why might, I know a lot of people come to see you for the pregnancy and postpartum part, but maybe some other reasons someone might come to see you. And then if someone is like really like invested and want to see pelvic floor PT, is there like, can they see you before that 6-week mark, and kind of when are they able to book that appointment? So kind of a two-part question.
Yeah. So I am trained up in both orthopedics and pelvic floor. So I'm board certified ortho, and then also all the pelvic floor things. So for me, you can see me for either of those, but then physical therapy generally has lots of other departments, kind of just like nurses and physicians. There's lots of different specialties. So with pelvic floor, the most common stuff that we're seeing are incontinence, so leaking, constipation, pelvic pain, so pain really anywhere, whether it's your vulva or testicular pain, anywhere down there. A lot of specific kinds of diagnoses like endometriosis, IC, or interstitial cystitis, and prolapse is a big one, or heaviness. And then diastasis recti is a big one. Then if you kind of go more the ortho side, which also includes pelvic floors, a lot of low back pain, round ligament pain, diastasis recti in pregnancy, hip pain, knee pain, shoulder pain, all the pain.
Oh gosh, we start going down the rabbit hole.
And lots of surgeries. So surgeries, I think, is what we're known for the most. So we help you out with bridging you to getting you back on your feet, literally, and functioning as best as possible. What was your question with the?
So curious on, you know, let's say, because we were talking about how some people, you know, really want to kind of get things going.
Yes.
Like if they did just have a baby, or if they, I'll start with the postpartum first. Like, can they see you before that 6 weeks if they are really like looking to make changes?
Yes. So with postpartum, you can start to see. I recommend, at least in my clinic, the earliest is 2 weeks. I always tell people at least give yourself 2 weeks, because a lot of times that's swelling and healing, and like you really should be kind of laying low at home. And if there's any emergency things, then that's more ER and your physician. Prior to the 6 weeks, a lot of times if people have low back pain that's just unrelenting, like get your booty in here and let's see what we can do. Incontinence, mild incontinence, is deemed within norms in the first 6 weeks. But if there's like full emptying of the bladder, then I'm like, all right, let's at least check and see what's going on there, and also loop in your physician as well. So a lot of people will come and see me in the 2 to 4 week zone if they're having a lot of trouble, but we do not do any internal work until at least 6 weeks when you're cleared. So as far as having an internal exam, of having your pelvic floor examined, we wait till 6 weeks. And then people who are doing awesome. Sometimes just wait till the 6 to 8 week to do the just in case, check me out, see what's going on. And then also there's new protocols that are being released and hopefully keep getting updated, but return to sport and return to running is now out. So in the past, it's always been like, oh, 6 weeks, return to whatever you want. And now there's much better information that we should really be waiting somewhere between 3 to 6 months for that. And there's a whole screen for it. So now there's with a lot of my patients, I've been trying to incorporate that screen. And if they're already current patients of mine, once we kind of reach that threshold, even if they're not runners, we kind of screen for that, because then that's more like HIIT and any type of sport really that you want to. And really, kid wrangling, in my opinion, is kind of a sport. So it clears out a lot of the running and jumping and twisting and quick moves. So that's kind of the timelines of when you can come and see us. It's essentially anytime you want. And then even if you're 5 years out and you feel like you waited too long, or you have kids that are teenagers, grown, whatever, come on in. Just like any injury, just like an ankle sprain, low back pain, whatever, the longer you wait, typically it takes a little bit longer to rehab, because now there's some other stuff that's usually gunked up in there. So the quicker you get on it, usually the quicker you're out of our office. And the longer you wait, it might take a little bit longer, but it's still worth it, because then you can get rid of it. So it is always recommended to try it out, and then also team up with someone like Erica. So then that way we get the best results fastest. So
Awesome. Yeah, and that actually, you had kind of taken one of my questions, which was, is it ever too late? And the answer is no. You can always go. Pelvic floor physical therapy is helpful no matter if you had a child 3 months ago or 30 years ago. I think that, to Dr. April's point, if you had your child 30 years ago, there may be more, habits that have been ingrained over time. And then also, if you had your child 30 years ago and, if there's scarring, or if you had a cesarean, then obviously things have it's not as easy to get some kind of movement through the tissue and some of the scar tissue when it's 30 years down the line. That doesn't mean it can't be done, but it's not quite as, I don't want to say fresh, because that's a bad word, but you know what I mean? It's not quite as new. And just to throw it out there too, because my next question was about cesarean and scars. I had hernia repair after my first, and it never even occurred to me until like literally a month ago that I never did any type of scar tissue mobilization or any work around my scar at all. And it was kind of lower in my groin area, probably right around where you would have expected like a cesarean. The C-section might have been a little bit higher, but in that general area. And then during my second pregnancy, I had horrendous SPD and like pelvic pain. And it just occurred to me there could have been a relationship there. So these are the types of puzzles that get kind of pieced together in pelvic floor PT, which is amazing. And that kind of leads me to kind of cesarean. If someone does have a C-birth, should they still come to pelvic floor PT? What would they expect in a session that might be different than if they had a vaginal delivery?
Yeah, so I feel like C-section sometimes gets a bad rap, or there's some funny assumptions with it that, if you have a C-section, you're not going to leak, or you're not going to have prolapse. Or now the data shows that it's slightly lower with C-section, but all the same diagnoses happen with C-section and vaginal. So it kind of doesn't matter. With C-section, I think it's almost sometimes more important, because to me, I view my postpartum patients pretty much like post-op patients, like you had surgery. Now with C-section, you legit had surgery. And so working on the scarring and the wound, and also helping you try and get back to normal life as quickly as possible is our goal. And it's also just second pair of eyes on you with the follow-ups with OBGYN. There's not very many, especially if you compare it to orthopedic surgeries. So I've had surgeries on my wrist, and I went in, I think, 6 times, and the appointments were short, but nonetheless, it's getting eyes on me and making sure I'm okay. And with postpartum, there isn't a lot of that. So we are a set of eyes, medical, healthcare, and also someone to help guide you to get you back on your feet and moving and grooving within reason and quickly. So we're just there to accelerate that healing as much as possible.
That's fantastic. Yeah, I will say that my second, after my 6-week checkup was maybe 10 minutes just to make sure things look okay down there. And albeit I know a lot and have a lot of questions that I come with, and I'm very specific and direct. So she's kind of like, okay, well, you know what you're doing. You're going to pelvic floor PT. Okay, great. All right, well, things look good. You're good.
Yeah.
Like that was my 6-week checkup. So being able to work with someone like Dr. April is just so valuable, because you're going to get so much information about your body and making a safe return back to movement, or even just learning strategies to pick up your child. I hear from a lot of moms that they're instructed not to use their core or not to do certain activities. Don't lift above 10 pounds, don't lift above 20 pounds. It's like, well, my 2-year-old's like 38 pounds. My 4-month-old is 15 pounds. He's a chunker. So, you know, we just went yesterday. So, you know, how can I be expected not to utilize my core when I'm carrying, you know, I'm basically doing a rack carry, like with my 35-pound kid. So it's kind of mind-boggling. And, you know, I just to kind of continue on just learning a little bit more about you. I know you're based in San Diego, but you also do mobile. How would someone be able to connect with you and schedule an assessment or a visit?
Yeah, so I have a clinic downtown off Kettner, so near Little Italy and the airport. And then I also do mobile visits. So I realized working out in the clinic, especially after you have a baby, it's so hard to get out of the house and carry all the junk. And then you have to time the nap and all that stuff. So I always vowed once I went out on my own that I'm doing mobile visits. So I serve pretty much all of San Diego County for the most part. Just the further away, the availability gets funny. So I really do all over San Diego. And then at my clinic is really easy. You can book online, and you can also reach out to me on Instagram, on Facebook. And then also I have a full website. So my phone number is on there that you can text me, call me, email me, all that stuff. I am currently a one-woman show, so whoever answers is always me. So it's been a wild ride. It's been really fun. And with COVID, it's also been really nice, actually, because then people don't have to worry about coming into contact with a ton of people. So in my clinic, it's just me. So we have a 2-room clinic, and you just hang out with me. So also if you bring your kid, just us. So it's been really nice to do more concierge, one-on-one care, where you're not kind of going through the motions, fast food style. So it's been lovely.
That's also something you mentioned I wanted to bring up, and is that typically with pelvic floor physical therapy, of course, call and ask whomever you see, but in my experience, because if you are a new mom, it's typically okay for you to bring kiddo along.
Yes.
For personal experience, I know it can be very stressful. So the mobile visit, oh gosh, I think I was like breastfeeding and getting an exam at one point, you know, like it's very stressful, but so that's why the mobile is so convenient as well, if that's an option for you. And I did, in relation to that as well, if someone should want to, do you do virtual consults as well right now?
Yes. So I've been doing telehealth before COVID. And so I can do it over video. It's all compliant and stuff. So no one can see it. And so you have your privacy taken care of. But yeah, lots of different options to be treated for telehealth. You just have to be in the state of California. So you have to be, whoever you see has to be licensed in the state that you're in. So
that makes sense. That makes perfect sense. Gosh, I went through all my questions. So I wanted to give you an opportunity to share anything just about pelvic floor physical therapy that, that you'd want to kind of bring up with a new patient or a prospective patient, or even just a new mom who's trying to navigate postpartum and her body. I know that those first couple weeks are very challenging, not only just emotionally, especially, hormonal shifts, lack of sleep, trying to figure out the feeding situation, but also physically. I've had a couple moms reach out to me recently. It's like, is it normal for my core to feel like jello? I'm like, well, yes. Yeah. Like it is, but I promise you over time, we build strength, awareness. I remember after my second, I was still wearing my belly band support just because my low back was hurting so bad. So I just kind of also want to normalize that experience and help, give moms the confidence to be able to reach out to you. So just kind of an opportunity for you to share anything you want for that mom maybe who's listening and still deciding if it's something she wants to try.
Yeah, there's a couple of things. First and foremost, I really advocate grace. Give yourself grace. It took 10 months to grow that baby. So the rehab or the getting back to wherever your goal is, maybe not getting back to wherever you were, but getting, back to the sport you want to play or the activities you want to do is going to take some time. So, and then all the pillars of healing are sleep, exercise, stress levels, and nutrition. And all of those items are really hard to obtain perfection during the postpartum period, let alone ever. So we're always visiting those pillars of healing. And if you're not getting the results you want, go back to those. And also, who are the pros on your team? And so I always advocate a nice team. So we've got Erica, who's trained, make sure they're trained physical therapist or personal trainer who knows the postpartum and pregnancy world that has the certifications. Not everyone has that. It's actually kind of rare in San Diego. There's only a few of you. And then, your physical therapist, are they actually trained in pelvic floor? Believe it or not, there's some people who get a pelvic floor referral at their clinic and they say, oh, I can do it. So watch the certifications. You have your OBGYN, lactation consultants, dietitians, doulas, and then postpartum doulas. There's so many people ready to help you out. It's just sometimes hard to find. So check certifications right now. It's very popular to be helping in this field, which is great. I'm glad people are talking about it, but sometimes they don't have the certifications for you. And then my other point is to just make sure that you're helping one another. We're all in this together, helping each other, just doing better. I'm on so many mom groups, and
I know you are. I've seen you. I think I've tagged you in comments before.
Yes. And so there's so many comments that are pushing people down or saying, deal with it, or I had it worse. Let's support each other and advocate for each other. There's so many resources. Let's really help each other out and lift each other up, because we're all really here to help, and we can do better. But there's so many people ready and willing to give you the help that you need.
Awesome. I think that's a great place for us to end our conversation. I just want to reiterate what Dr. April said about building your village, building your support team. So, your partner, your family, friends, but then also the professionals that can help you while trying to conceive, while pregnant, postpartum, or really at any point in life, whether you're a male or female, quite honestly. So Dr. Abel gave a few. I'd also recommend a Webster certified chiropractor, maybe acupuncture.
Mental health.
What'd you say?
Mental health too.
Oh yeah, of course. Yeah, a mental health professional. Quite honestly, like just having that support is going to be huge. And then getting the support you need to be able to give yourself the time to see Dr. April. So if you do not want to bring your child with you to the appointments, or you don't want a mobile visit per se, having someone be able to watch your kiddo for just that hour so you can spend that time to yourself. Investing in your health and well-being is so important. And as Dr. April mentioned, I'm based here in San Diego. There's a few of us here in San Diego, and my focus solely is on the pregnant and postpartum body, as well as trying to conceive, because there are special considerations there as well. So find a coach, find a pelvic floor physical therapist, and a village that can support you, that has the knowledge and the certifications, and is also not afraid to say they don't know, and they refer out to another member of the village. I have people ask me all the time for specific questions, like, that's not really my area. I think you should see a pelvic floor physical therapist. They're better trained in that than I am. So with that, thank you, Dr. April.
Thank you.
And I am going to post this to my feed. Of course, tag her if you have any questions about pelvic floor physical therapy, are interested in a consult, or just want to ask a few questions. Say hi. She's very friendly, and I hope you guys have a fabulous night. We talked for a while, but that's because you're just so nice, and I always like talking about pelvic health. So I will end the live and get this to my feed, and I hope you guys have a great night. Thanks so much, Dr. April, for joining.
Thank you.
Bye.